Okay, well, being 6 o'clock, I'm not sure we need it this loud. Can you guys hear all right? Too loud, just right? Okay. All right, well, we're going to go ahead and get started. So my name's Louis Zumbaugh. I'm your District 3 Supervisor for Linn County. With me today on my far left is Darren Gage, Director of Policy and Administration, Stacy Mead, Financial Management Director for Community Services, and Tamara Marcus couldn't make it, but she does have a video for us to watch. And from there, I'm going to give it to Darren. He's pretty much going to run the meeting until we get toward the end and do questions, and then maybe I'll moderate it or something. So,
thank you, Louie, and thank you all for being here tonight. While we are the presenters, I do want to point out that doesn't mean that we're experts on the American Rescue Plan. We are the people at the county who have done the most reading on it and who are coordinating the county's response to it, but we're still learning. We still get guidance weekly from the Department of Treasury, that is the U.S. department that's responsible for administering the act. They update their frequently asked questions all the time. Our accounting department is still getting guidance from the Government Finance Officers Association in terms of the reporting requirements. And so while we are able to share a lot of information with you, there's information we don't know, questions we may not be able to ask, and so we're still learning. A broad overview of the American Rescue Plan Act is that it's a $1.9 trillion relief package. And I want to be deliberate about using the word relief because it's just that. It's not meant to be a stimulus package like the CARES Act or some other funding which Congress intended to get out the door quickly. So this gives us an opportunity to be more deliberate, more planful with the spending, and that's exactly what we're doing, and one of the reasons why we're doing this public engagement process. Because this is really $44 million that Linn County is receiving is once-in-a-lifetime funding, and we want to make sure that we're doing transformational projects with it, projects that matter. And so we do get asked from time to time why we start spending it yet, but that's the reason why. We want to make sure that it's really going to the best use that it can. And so within ARPA, which is the general package, there are 9 different categories of funding. Those are some of the tax credits that you may be aware of. That's the direct economic relief payments. One of those categories is the Corona State and Local Recovery Funds. And so that's a $350 million fund from which Linn County is getting its payment. And we're going to receive just over $44 million. Every U.S. county, there's about 3,600 of them, and every city over 50,000, which the Act considers an entitlement city, will get their payments directly from the U.S. Treasury. In Iowa, cities under 50,000 will be getting their ARPA money through the state, and that's going to come at a later time. Linn County has already received its first installment, so we've received a $22 million payment from the Treasury, and in about 12 months we'll receive the other installment. The funding can cover costs that were incurred as of March 31st of 2021. We have until December 31st of 2024 to obligate the funds, to decide how we're going to spend them, to contract for those uses, and then until December 31st of 2026 to spend those funds. The next slide, you may not be able to read it. The detailed information isn't essentially important. It's just to illustrate that those are the amounts that the other Linn County cities that aren't receiving their money directly from the Treasury are going to receive. Cedar Rapids is receiving approximately $28 million of ARPA funds. So for example, Mayor, what is it, Central City is $193,000? So, have you received that yet? Yeah, the first half of it? Okay. So the eligible uses, there's broad categories for eligible uses within which city councils, boards of supervisors have pretty wide discretion on what qualifies, as long as, in general, it is something that has been caused by the COVID-19 pandemic and is a response to it, with some exceptions. So the eligible uses are to respond to the public health emergency and its negative economic impacts. In the next several slides, I'll go into some examples of these. To respond to workers performing essential work, to provide government services to the extent of the reduction in revenue, and to make necessary improvements in water, sewer, and broadband infrastructure. There are also some ineligible uses. We can't make deposits into pension funds. We can't establish rainy day funds or reserve funds. We can't pay off debt or use the money to pay for the issuance of new debt. And we can't use the ARPA funds as matching funds for other federal programs. The money does come along with some pretty stringent reporting requirements, and if we're found to have an eligible use, then we're going to have to pay that money back. So reporting will be a big part of this. As far as the public health emergency goes, again, that first category was to respond to the public health emergency and its negative economic impacts. We've broken those into two here because those are pretty broad categories. And so the public health emergency is to provide services to respond to COVID itself. You see some examples of eligible uses. Mitigation and prevention can include things such as vaccination, testing, the purchase of personal PPE, contact tracing, supports of isolation and quarantine, things maybe like Meals on Wheels or transportation. Medical expenses are just that, direct payment of medical expenses. Behavioral and mental health care can include mental health treatment, crisis intervention, hotlines, substance abuse treatment. Public health and safety staff is to pay the wages and benefits of public safety personnel and public health personnel who are directly responding to the pandemic, and then to address disparities in public health outcomes. And throughout the Act itself, as well as the interim final rule and some of the other guidance that we've seen, this disparities in public health outcomes, the idea of equity is woven throughout the Act, and it's a real focus of it. And the reason for that is because disparately impacted communities, communities that had disparate impacts economically, communities of color, were disparately impacted by the pandemic when you look at the amount of positive tests and things like that. So Congress really wants us to make sure that this is an equitable recovery. And to determine eligibility, you need to ask yourself, what is the need or the negative economic impact? Was it a result of COVID? And how does this intervention, how does our proposal respond to that need or impact? Negative impacts is also another pretty broad category, and it's to address economic hardship, things like closed businesses, lost jobs, or folks who have had to stay home because their kids are doing online learning, something like that. And the list of eligible uses, supports for households and individuals includes unemployment assistance, food and housing assistance. Support for small businesses and nonprofits can come in the form of loans or grants directly to those small businesses or nonprofits, which are all eligible to apply for this funding from Linn County. Supports to impacted industry. And the rule specifically mentions travel, tourism, and hospitality. But it's very clear that those are only examples. And that if in your locality, in your specific locality, if you have an economic sector that has like or worse impact, those sectors are also eligible. And for travel, tourism, and industry, it was a 24% decrease in revenue and about a 17% job loss. So locally, if we see that nursing or welding or whatever agriculture had a similar or worse impact, and we can document that, then we can use that funding to help those sectors as well. And then again, to address pre-existing health and economic disparities. To determine eligibility, the same as the first one, ask yourself, what is the need? Was it a cause of COVID-19? But here, because of that last bullet point where it says to address pre-existing health and economic disparities, if there are specific, for example, qualified census tracts or communities that we can document were disparately impacted economically, educationally, socioeconomically before COVID, services to those groups are presumed to be eligible, whether or not it's a direct response to COVID. Premium pay is the next major category, and the definition, the ultimate definition of essential workers is up to the Board of Supervisors or to the City Council who is distributing the funds. But what the Act really intends it to go, for whom it to go to, for the workers for it to be eligible for it, are workers who had to continue to report during the pandemic, who were frontline workers, who were transactional workers that dealt with money, social workers, teachers, people who had close contact with other people and put themselves at a greater risk to contract the virus. Government services. So you might hear this referred to as lost revenue. Congress provided a very specific formula to determine lost revenue, and as I mentioned previously, for Linn County, that was mostly in the form of state grants or other state revenue that we received, and it was about $7.1 million. That's not in addition to the 44, it's part of the 44. So the Board of Supervisors has the discretion for that $7.1 million to use it to provide government services that aren't subject to the other ARPA rules. For example, we would have some leeway here to do something with a building that wouldn't qualify under the infrastructure funding. And what it's meant to do is respond or restore interrupted services or services that had to be curtailed or cut because of the pandemic. Now, that's not a mandate that boards and councils use the money that way, but it's discretion that they are given. And then water, sewer, and broadband infrastructure. And it's important to focus on those three words because it's not infrastructure in the general way that we may typically define it, like roads, bridges, sidewalks. It's specifically water, sewer, and broadband, as well as green and resilient infrastructure. So again, buildings don't qualify under this category, but if we're doing a COVID mitigation or if we're building out resiliency for the next pandemic, we can do things with it. For example, if we wanted to add a drive-through to the public service center where the treasurer's office is and you get your license plates and we had to close that building again and close the lobby, a drive-through, for example, would be something that would be eligible. Or we can use it for heating and ventilation and air conditioning in the jail or the juvenile detention center where we have inmates and we may need to isolate them in wings with negative pressure so that if they were positive, the virus doesn't spread. So it's important to know that generally infrastructure isn't eligible, but if it's a pandemic mitigation response, then there are some ways to respond to it. And broadband infrastructure is eligible, and it's a very, it's at the forefront of a lot of discussions, but one of the things that we're doing is looking at other eligible funding sources as well. The state of Iowa, the legislature recently passed about $100 million for Connect Rural Iowa. The infrastructure bill that's being considered by Congress has about $6 billion identified for broadband. So there's a possibility or a probability that as we receive applications for this funding, when we see applications for uses that have other funding sources, we might steer them towards those and use ARPA funds for projects that this is the only money that they qualify for. And that is the end of my section.
Good evening. I'm Stacy Mead with Linn County Community Services, and I'm going to start off by talking about the Emergency Rental Assistance Program. This is the second round of federal rent assistance that's come into the community, so we'll refer to that as ERA 2. The first round was administered by the state, and the second round is being administered by Linn County. There are some slight differences in eligibility that I'll talk about over the next couple slides as compared to the first round. Okay, so a little bit of background on this ERA 2. Linn County received a total allocation of $5.3 million. We started receiving and processing applications on August 16th. And when this new round of money started on August 16th, Linn County residents were no longer eligible for the first round. However, the state is able to refer interested applicants into our program now that they're eligible for only ERA 2. Eligible participants can receive up to 18 months of rent and utility assistance. This can help stabilize households, and it will also help the landlords who have experienced a significant loss since the pandemic as well. The rental assistance itself can go back to March of 2020, and it can go forward up to 3 months. So eligibility for ERA 2, to be eligible, applicants have to be under 80% of AMI, which is the average median income. And for context, that's about $50,000 for a household size of 1 and $65,000 for a household size of 3. They must demonstrate housing instability or unemployment. And the next one is demonstrated hardship since March of 2020, and this is where it's a little bit different from the first round. Under ERA 1, the financial hardship had to be due to the pandemic, and under ERA 2, applicants just have to show a demonstrated financial hardship. So this is helpful because even if your hardship was due to the pandemic, sometimes it's really hard to quantify or document in a solid way. And it's also especially helpful in our community because residents who may have had a financial hardship due to derecho can now qualify for this assistance as well. Lastly, the program is prioritizing households under the 50% of average median income with a pending eviction or utility shutoff. We want to both ensure that we're getting to the most at risk as quickly as possible to avoid an eviction, but we also want to get funds into the hands of landlords to help them have a more stable tenant base and help them retain their current tenants. So looking ahead to a couple community issues, I'll touch on two top community issues, but I wanted to point out that the community as a whole has pointed out many pervasive issues since the pandemic. A lot of that work's been done through LAP-AID, which stands for Linn Area Partners Active in Disaster. This group's done a lot of work to identify different challenges in Linn County. They've been meeting regularly since the onset of the pandemic and throughout the derecho disaster as well. So the first topic I'm going to touch on is childcare in Linn County. If this is an issue that you follow, you'll know that this was already a pretty difficult situation for our community. So these are some figures pre-pandemic. Childcare providers lost 35% of their businesses from 2014 to 2019. So we were already on a steep decline for available providers. And the 14,840 slots shown there, that's the gap in services that existed prior to the pandemic. So we already had a pretty hefty gap to fill. And looking ahead at the current state of childcare from July of 2020 to July of 2021, several childcare businesses closed, and this is so rapidly changing that since the slide deck was prepared, it moved from 36 to 44 childcare businesses that had permanently closed. There are several reasons for this during the pandemic. One would be reduced capacity because of social distancing and CDC guidance, which, as you know, would reduce the revenue for those centers and make it harder for them to even break even. There's a high cost associated with PPE when you have to keep staff and the children that are attending safe. Lack of staff, this is due to fewer people entering this profession, and a lot of that can be due to low wages or lack of benefits in that field. And then lastly, derecho damages hit home child care providers particularly hard. The next issue I'll touch on is homelessness. I'm going to only touch on a couple factors because this is a very broad issue in Linn County, and I'll give some pre-pandemic and post-pandemic information. So looking at this slide, this graph is the number of people living on the street pre-pandemic. It does not include those that lived in emergency shelter or those that were considered to be doubled up, which means they're living with a family member or a friend, but not in their own home. So this data is gathered by a point-in-time count conducted by shelter providers and trained volunteers that actually go out in the community and count the number of people living on the street and people that are living in places not meant for habitation, like cars. So you can see that pre-pandemic, the numbers would fluctuate between the teens and the 30s, up into the 30s in the warmer months. And then currently, this is the new data, post-pandemic, you can see that the increase has been pretty sharp. We're showing about double what we had seen in past years. So there are many reasons people will end up homeless, but some of the main drivers are affordable housing and eviction. Right now there's the eviction moratorium, but prior to that we did have a pretty high rate of evictions in the community. We had more than 4 households in Linn County receiving an eviction notice per day, with about 2 of those actually formally being evicted. And in 2016, the city of Cedar Rapids was ranked 89th for its rate of evictions nationally, and that's what they would consider a top evicting area. So we know a lot of people in the community are struggling to make rent. There's an estimated 4,000 renter households that are behind on rent, which accounts for 1 in 7 of the renter households in the county. It's estimated that those households are behind by about $3,000, which, as you can imagine, is a very significant gap to fill without some kind of assistance to help get caught up. We also know that the households that are behind in rent or are struggling are able to reach out to for assistance. Linn County is the coordinated point of entry, or Waypoint is the coordinated point of entry for Linn County residents. They coordinate homeless services and rent and utility assistance across the county. From July 2020 to June 2021, more than 9,000 Linn County renters reached out to Waypoint to try to get some kind of rental assistance. We also have taken a lot into consideration for the landlords, as I mentioned before, and so Waypoint is working with Linn County to administer these ERA2 funds and get payments out as quickly as possible to stabilize the tenant base and stabilize the households. So next, we're going to turn it over to the video in our slide deck of Tamara Marcus, who will talk about equity, as Darren mentioned, is kind of woven throughout the issues within the ARPA Act.
Hi everyone, I'm Tamara Marcus, the Linn County Sustainability Manager, and I'm going to speak a bit about the emphasis on equity throughout the American Rescue Plan Act. So I'm going to read straight from the Act, from the text on the screen now. It reads that these resources lay the foundation for a strong, equitable economic recovery, not only providing immediate economic stabilization for households and businesses, but also by addressing the systemic public health and economic challenges that may have contributed to more severe impacts of the pandemic among low-income communities and people of color. And so we spoke a bit about housing earlier on and how we see this play out within Linn County is represented by this figure on the screen. So in red, we have our renting population, and blue, we have our rental assistance seekers. And we can see from the far left that 77% of our rental population is composed of white residents of Linn County, where 45% of the request for rental assistance is coming from that community. Conversely, we see that 13% of our rental population is Black people with Black residents within Linn County, requesting 35% or making up 35% of those rental requests. So again, looking at this disproportionate impact of the pandemic on rental assistance and requests within Linn County, we see a similar trend play out within the 2 or more races, as well as the Hispanic community as well. If we're talking about the health impact on COVID, the health impact on communities within Linn County and how that shapes out across race, we see by this figure represented or shown on the screen. This is from Linn County Public Health data, and this shows aggregate data across from the start of the pandemic until just up until a couple of weeks ago. So we see that the percentage of the population of white residents that have gotten COVID or have had positive tests for COVID is about 4.89% compared to 8.22% in the Black community. So we see that Black individuals or Black residents within Linn County are testing positive for COVID at 2 times the rate, almost 2 times the rate of their white counterparts. When we look at Native and Islander communities as well, we see, again, a higher rate of positive tests relative to the white population within Linn County. So part of the objective of the American Rescue Plan is to also address systemic challenges that may have contributed to that disproportionate impact of the pandemic. And so here on the screen, we see within Linn County, about over 30% of our Black residents are below the poverty line, compared to just under 20% for Hispanic, excuse me, and under 10% for our white residents of Linn County. So these are potential systemic challenges that may have contributed to part of those, to some of that disproportionate impact we see of the COVID virus. And so when thinking about how to utilize these funds, taking into consideration some of these systemic challenges that could have contributed to that disproportionate impact, will help us better utilize these funds. And so certainly when we're thinking about measuring disproportionate impact, this can also, of course, extend outside of race. So we can use things like the qualified census tract to determine how to direct funds. And so in locations where 50% of households have incomes below 60% of the area median income, or areas where there is a poverty rate of 25% higher, or a poverty rate of of 25% or higher, these could be areas that we might look at to direct funds, ARPA funds as well. Because we know that individuals living in low-income communities may have had more of a limited ability to socially distance or to self-isolate. And so we want to take those facts into consideration when thinking about the most equitable way to distribute the ARPA funds. And so you may have questions around how derecho might play into distribution of these funds. So again, I've taken this directly from the Act language from the Act itself. I'm going to read this part in yellow. It says that while COVID-19 affected many aspects of American life, eligible uses under this category must be in response to the disease itself or the harmful consequences of the economic disruptions resulting from or exacerbated by the COVID-19 public health emergency. And so when you're thinking about, if you're thinking about applying for these funds, make sure that the connection to the impact of COVID is very clear in the application. You can certainly include other impacts and other circumstances that you think are worth considering, but definitely make sure that they tie to COVID and that negative impact, either financial or public health wise, is made clear in that application. Darren also mentioned earlier on that there's some potential to use this money for green infrastructure. So some of the eligible uses are listed here. Uses that fulfill the objectives of the Clean Water State Revolving Fund are among the eligible uses for ARPA funding as well. So constructing wastewater treatment plants, controlling non-point sources of pollution, managing and treating stormwater, things of that nature. And then also eligible uses include building or upgrading facilities and transmission and distribution and storage systems of water, and replacing things like lead pipes as well.
So the process, where we are in the process as Linn County, is this is the third of 3 scheduled public engagement forums. We're also simultaneously conducting an online survey. Can you launch that from there? Can you click on the hyperlink from where you are? Okay, thank you. And so the purpose of what we want to primarily use that information for is to determine how to split the $44 million into different eligible funding categories for distribution. So we're asking for public input on those major categories. We'll see what rises to the top for priorities, and then try to allocate significant amounts of money throughout. What we don't want to do necessarily is just give out the money first come, first serve, or give it all to one economic sector. So this is going to help us ensure that we're spreading it across, similar to the Water and Land Legacy Bond that we have for $40 million, where we have some guidelines, certain percentages that go to park improvements, certain percentage go to trail improvements, certain percentage goes to water quality. So if you haven't already, if you haven't seen this survey, and it's at linncounty.org/ARPA, that's our ARPA homepage, our landing page, and there's a link there that says take the survey. I encourage you to take it. Please do take it. What it's going to ask you to do is rank priority those 5 major categories that we talked about: COVID-19 negative economic impacts, the public health impacts, premium pay for essential workers, government services to the extent that they were lost revenue by COVID, and then water, sewer, and broadband infrastructure. If you just click on Linn County, it should. And then 3 of those major categories have several subcategories because they're very broad. So there's a total of 4 times where we're going to ask you to rank priority. The first one is the major broad categories, and then 3 times there are subcategories that you're going to be asked to rank in priority. It also works on phones, on smartphones. If you are using your smartphone, you'll see over to the right of the section the three lines, what some people call hamburger buttons. You'll need to click on those. And so there's not dots to fill in or numbers that you type in. You're going to see each of the choices in a bar, and then you just drag those bars around into the ordering that you want. And please, I also would encourage you and ask you to share the link with other Linn County residents that you know that may be interested. Here we go. Britt, you want to go ahead and just reorder and kind of show them how it works there? Yep, so that's all you got to do is click and drag them around. Thank you. It does ask for some demographic information at the end. We're interested about how the results break down by zip code in Linn County, by some other demographic information. All the demographic information is required except race or ethnicity. You're not required to answer that one. There is a box further down if you want to scroll down. I think it's limited to 255 characters, but you can describe an idea you have that you may not think fits in one of those categories above. And keep in mind, while 255 isn't a lot of characters, you will have a chance to apply and describe that project further. So that gets us to the application process. What we intend to do is make an application process available to the public, to nonprofits, to small businesses, to the 17 cities in Linn County that didn't receive money through the federal government, directly from the federal government. And what we don't have today, though, to hand out is that application. We don't have that application finalized because, as I mentioned earlier, we're still learning from the Department of Treasury, from the Government Finance Officers Association about eligible use and reporting requirements. And in addition, we expect to receive a lot of applications from nonprofits, small businesses, particularly in Cedar Rapids and Marion. And so we're trying to coordinate our application process with them so that people don't have 3 wildly different forms to fill out, and that we also don't duplicate awards. So the best that I can tell you is sometime this fall. I wish I had a better date for you, but sometime this fall there'll be an application available. Survey will be open for a while. Please take it. Please share it with others as well.
Yeah, share the survey information with others. The more people that participate, the better information that we have. So I guess at this time, if does anyone have any questions? Would you want to come up here to the? We can't hear you. I couldn't hear you. You heard? Okay.
So I'll repeat the question just in case it's not appearing on the recording. The question is, will people need a user login or password to log into this survey? The answer is no. Just click on the link and it will come up. Yep.
Any other questions? Well, with that, I'd like to thank everybody for coming. One thing I'd like to add, we're going to concentrate is one-time money. It's going to be for one-time projects. I'm trying to emphasize on the one expensive. That's important to put out there. I'm sure we'll have $44 million in dollars. That's a lot of money. But the scope of things to go fast. For instance, yesterday we awarded $165,000 in grants and over 400,000 applications. And I don't think this is going to be a whole lot different. And maybe end up with $100 million worth of tasks. Actually, it's less than $4 million. It's 37 came out on top. We lost revenue. If there's no other questions, yep.
I'm the type of person that takes a second to think through things. I guess my first question is, so a part of that outline is that assistance with funding mental health, behavioral health, substance use disorder, things like that. You additionally outline crisis services. Will the Board of Supervisors be defining what is crisis services? I come from the perspective, so I'm the Iowa Associate Program Director for Riverview Center. If you're familiar, we serve survivors of sexual violence, which adds in the components of crisis services and what we've outlined throughout the pandemic. And so what mental health crisis services such as Foundation 2 provides may look a little bit different. So I wasn't sure who would be truly defining that.
If you want to follow up on this too, Stacy. So as I mentioned earlier, the act itself, the interim final rule, gives city councils and boards of supervisors pretty wide latitude to make awards within those categories in those illustrative uses. So if you can make the case, right, and if you have for example, the Department of Human Services or another funding source, that you can point to and say, here is an agency, or here's a funder, or here's a regulator that defines this as a crisis service, just make the case.
Okay.
Yeah. Would you ready?
Okay. The other question I had is, what is the Board of Supervisors' responsibility in ensuring that the survey gets to our disproportionate communities that are increased in isolation? We can send it through our internet platforms and other social service providers, but in reality, who are your champions going out in the community to address those certain issues and ensuring that that gets in the hands of these people that are disproportionately affected?
Well, thank you for asking that question, and I think that the honest answer is we really don't completely know that, and that's part of the reason that we're having these forums. We want to hear from organizations like you that can help us do those kind of things. We're doing as much as we know how to do electronically, but yes, we also do have the responsibility to push it out in other ways. And if you have ideas, if you can help us do that, we'd be glad to provide it in paper or in other formats.
Absolutely, I appreciate you answering that question. I'd love to support that in any way.
Sure.
So.
I have more of a comment. I'm Dr. Cecilia Rakusek, the President and CEO of the National Czech and Slovak Museum and Library. And I'm here really on behalf of all of our cultural nonprofits because and I'm a healthcare provider myself in my former life, and I just want you to be really careful when you're looking at the applications to consider the role that cultural institutions and nonprofits play in mental and physical health. I mean, that's something we don't often think about, but as a public health professional myself, now as a museum director, I can tell you that the mental health and the physical health of people is really impacted, and the key is all ages. I think we certainly know the child care crisis, we know that, but we also have a significantly aging population. I like to think of maturing adults. And these are the ones that really benefit from our cultural institutions. And because of the lockdown, they've been so impacted. And, videos, and we're doing a lot of outreach, a lot of us throughout the state. But I think we need to never forget the lifespan approach that our cultural institutions are taking, and also the health aspect of that. So please consider that.
Thank you for sharing that. Thank you for those comments. And I would ask you to be very, very descriptive in your applications. There will be an employee team. There's about 10 of us that will review most of these applications along with the Board of Supervisors. And there's going to be, like Louis mentioned, a lot of applications. So while we are going to definitely want to do our best job to consider those kind of things, it may not be obvious, to all of us, to each of the 10 of us who do different things for a living within the county. So point those out would be the best thing to do in your application.
Any other questions? Well, I'd like to thank you all for coming. The only comment I'd add is piggybacks on how to get people to participate. I'd like to know the answer to that, because we specifically sent out letters to different organizations and cities, and we ended up with 9 to 10 people here. So if you got the crystal ball that tells us how to do that, I'd sure like to know what it is, because it is a struggle. But
In all honesty, in my experience of reaching communities that are disproportionately affected by victimization, is that you actually have to be present and hold space within those communities. This is, there are a lot of, as you mentioned, older adults impacted, persons who are able differently, communities of color, but I don't, you have to get out
Right, I understand that. In fact, we just came up with your idea and wrote it down, or part of your idea. So is there any other questions? Okay, well, with that, I guess we'll conclude. I'd like to thank each and every one of you for attending, and have a good night.